Good morning, Atlanta. I would like to take this opportunity to welcome everyone to the Mary Parker Foundation monthly community conversation. We're so excited today because we've got one more session. This is the second of our health and wellness series, and today we're going to talk more about insurances, but something that is very, very special to our community, and that is mental health. So we will discuss mental health, the impact that it has on both our physical, our families, and our communities. Today we have our host is Kenny Brown. Kenny Brown is a member of the Mary Parker Foundation, and he's also the president CEO of Brown Consulting Group. Kenny is a do-all man, and he's definitely one that I'm very, very happy to call my friend. Ladies and gentlemen, if you will please join me in welcoming our host, Kenny Brown, and he will introduce to you our guest for today. Thank you, enjoy, ask questions, and we're here to serve you. Thank you.
Good morning and welcome to this month's installation of the Community Conversation with the Mary Parker Foundation. As Dr. Parker suggested, we're happy to be here this month with a hot topic, physical health and mental health, and the challenges that both present. And we are joined here with two esteemed colleagues. Full disclaimer, I have worked with both of these professionals over the last couple of years. They're phenomenal in what they do, their commitment to the community, and their commitment to their business. So formally, let me introduce our subject matter expert on the physical health side of the business, Melissa Anthony. Melissa is a manager for one of the regional growth teams with Silver Sneakers. She'll be telling you more about Silver Sneakers and all of their offerings. In her own words, she gets to evangelize Silver Sneakers in her own territory of Georgia, South Carolina, and North Carolina, and supports her direct reports in their respective areas across the country, and that's from Texas to Pennsylvania. She's been with the company for over 5 years and enjoys most getting to connect with Silver Sneakers members and hearing stories about their workout journeys and the awesome benefits the program brings to their lives. Melissa is originally from Roanoke, Virginia, the DMV, and graduated from UVA. She's Yahoo? Wahoo.
Yeah.
Okay, I was close. Where she plays AKA. She has been married to Michael Anthony for 34 years and has 3 fantastic children. Welcome, Melissa.
Thank you very much, Kenny.
Our subject matter on the mental health side is a young lady, Jody Smith. Jody is the host of the Heart Helper podcast, and that's a spiritual platform where everyday people share extraordinary stories. Through raw vulnerability and heartfelt conversations, the podcast fosters genuine connection and inspiration for its listeners. A certified life coach and the author of the book of Real Shit, a collection of poetry and life thoughts and flowers in the garden. She'll elaborate. Jody's on a mission to serve as a minister of light and a fisher of men, and we applaud that. She's got a deep commitment to authenticity. She aims to inspire through her faith in a world often driven by influence. So good morning to you both.
Good morning. Thank you for having me.
Yes.
You do.
So we're going to get things started. I just want to share some data points, and then we'll jump into our topic. So if we go back to Merriam-Webster's definition of health, the condition of being well or free from disease. Physical health is a state of well-being where the body's organs, tissues, cells, and internal and external body parts function properly. It's more than just being fit and includes body systems functioning, body parts healthy and functioning, senses functioning. That's the physical health side. Nutrition plays a key part and exercise plays a key part. And I'm just curious as we start off, Melissa, when you think of those, that is a starting point. what comes to mind for you as far as physical health?
As far as physical health, great question. Listening to what you say kind of reminds me of what drew me to Silver Sneakers, which was my grandmother who lived to be 99 and 11 months and almost made it to 100. And so, she did all the right things right. So she ate well. She had vegetable garden in her backyard, flower garden in the front yard. She spent some time outdoors. She played in the dirt. She knew how to can her own vegetables and fruits. And I got to watch all of that the last 3 years of her life. So that kind of reminds me, all the things that you're saying helps with our longevity. She got exercise. She walked in the mall. She walked outside, spent time outdoors every day. All the right things right up in Virginia. And, all those things I know play into our quality of life as we age. So that's what those comments mean to me.
Okay, and even though Jody, your focus is more on the mental side, surely you have an appreciation of the physical aspect of good health and physical health. What does that mean and look like through your lens?
Absolutely. I kind of feel like they all kind of coincide. I feel like if you are not physically fit, you can't be mentally fit. If you're not mentally fit, I don't feel like you could be spiritually fit as well. So I kind of feel like they all go hand in hand. I personally go to the gym about 5 days a week and I notice a difference on my mental health. So I do know it plays a benefit. They both coincide. The more physically fit you are, I feel like the more mentally fit you are. So I feel like they go hand in hand together for sure.
Right. And obviously, times have changed, budgets and economics. I recall growing up, we all participated in phys ed daily in school. And I don't have any young children, so I'm not sure, but I understand that that's not the case in 2024, that that's more of an option as opposed to a mandate. You know, familiar with that?
Unfortunately, I'm sure that your son, experiences that. My kids are a little older. And, I think one thing that our kids are missing out on is, exercise releases endorphins. To your point, our happiness hormone. So, and we also, when we work out, we feel a sense of accomplishment. So, unfortunately, I don't know if, to your point, I don't know if people like your son and my kids, when they were younger, if they really get to experience that opportunity when they go back into the classroom after that 5 or 10 minutes of playing outside,
Yeah. And also it teaches us, indoctrinates you into physical fitness. If it's part of school, just like math, science, reading, physical fitness, you begin to, groom yourself accordingly as you develop through school.
Yes.
That's great. Some interesting facts in Georgia. Our community conversation, we're here in Southwest Atlanta, Campbellton Road. But when we look at Georgia as a state, there's some interesting tidbits here. The Centers for Disease Control and Prevention reported the following data for the state of Georgia. Adults 18 years and older, 37% were obese, 49.1% achieved at least 150 minutes of moderate exercise each week. A little less than your 5 times a week, Jody.
I try to get it in.
I know you do. Adolescents, grades 9 through 12, 17% of adolescents were obese. And 23.2% exercise for at least 60 minutes on all 7 days of the past week. Children aged 2 to 4, 14.4% of children in the Women, Infants, and Children program were overweight. That's gonna be our underserved community. 12.9% were obese, 59.2% of the infants were breastfed, and 45.8% of infants were breastfed for at least 6 months. So when you just look at some of these data points, you can see that the physical fitness piece is a major piece of society. I mean, it impacts everything. A fit mind, a fit body enables you to engage more in school, engage more in the workplace. So it's kind of interesting, some of these data points, where Georgia stands when you look at these factors.
Yeah, Kenny, I think that's unfortunate. I think here in the South, Mississippi, Georgia, Alabama, Our states unfortunately lean in that direction. I think we need to do a lot of education. I think we need to, bring back the exercise. I think food, what's in our food is a huge problem. I think, there are too many fast foods. I'm not saying that I didn't do fast food in the last week, but, there's.
Balance.
Yeah, you have to have balance, but, yes, I agree. I think that these are huge issues that need to be faced in our community.
Now, you mentioned the South and your territory overlaps. The
Yes.
South, Georgia, North
Yes.
Carolina, South Carolina.
Yes, yes, it does.
So what efforts are Silver Sneakers making to better engage seniors around physical fitness in the South?
We try really hard to make sure seniors are educated on all their options with Silver Sneakers. And what's good about it is that if a senior cannot make it into a gym, we also have online classes, numerous online classes. And to take it a step further on the mental health front, we have all kinds of mental health classes that someone can take right from their smartphone. Meditation, yoga classes, Tai Chi, we'll talk a little bit more about those, but all kinds of things. Now, and we also have nutrition classes as well, which I think, and there's a little bit of good news. I'm seeing some light at the end of the tunnel. I'm seeing more and more folks in our community who are trying to watch what they eat. We just have to make the food accessible. I think we as a community need to demand that organic foods make it to our area, that we learn how to plant gardens, that we learn how to even do container gardens if our space is limited. So that's outside of Silver Sneakers, but we are working on community kinds of information to make sure folks know about not only the physical health, but the mental health and the nutrition.
Sure, and that's an interesting notion that we're trying to revisit the notion of farming.
Yep,
There was a time generations ago where our folks in our community were master farmers.
yes,
And
Yes.
isn't it ironic now, whether it's a food desert or otherwise, we struggle to get healthy food.
yes,
We look first for the easiest, low-lying fruit,
fast
is often
food.
the worst
Yes,
choice to make.
yes.
It's oftentimes the most economical choice to make, so we've got a hill to climb on that.
yes, yes, we do.
And I think that, when the frustrations begin to flow from there, not being able to get to food, I'm thinking of social determinants of health, which affects your mental
Yeah.
health, fitness. And, Jody, what do you see as far as looking at just food insecurity and proper nutrition around social determinants of health? How do you see that impacting one's mind?
Well, I think right now, a lot of people are struggling financially. So where we would see people, that were a little bit more financially secure, they had the time to go to the gym, they had the time to be more active, they had the time to be more present with their children. Now people financially just can't afford it. So now we see people that are shopping at the dollar store for groceries. A lot of areas, not only in Georgia, but also Florida, they're food deserts. So people just don't have access to quality food. They don't have access to quality health care. They don't have access to even quality people that you're hanging around, So a lot of people are stuck in their environment. And I'm a firm believer that everything that we're meant to be, everything that we're meant to become, God has placed each of us to be seeds. You might be a rose, I might be a lily, you might be an oak tree, but we're a seed. And sometimes we're not in the right environment. So we never sprout, we never blossom, we never become. We're not around people that are giving us light. We're not around people that are giving us water. So it is affecting people's mental health. If you can't have access to healthy food, your mind can't really function at 100%. And studies show that a lot of people that are not eating quality foods, that are only eating fast foods, they're not functioning at 100%. They're low vibrational because their food is really not feeding their cells. And, people don't have access to fresh produce. So, their cells are not really working at the best capability that they can. So the world's heavy right now.
Yeah.
It's heavy. And that's why I make a conscious effort. My son's 10 years old, but I'm like, okay, let's make sure you're in football. Sometimes we do yoga. He complains about yoga all the time. I make him practice mindfulness because if you can manage your mind, you can manage your life. And I'm really big on
Say
that.
that again.
If you can manage your mind, you can manage your life. I went to Change Church this past Sunday. Pastor Darius Daniels was saying a lot of times people suffer from anxiety, they suffer from depression, and it is just it's a lack of discipline in our imagination. So people are suffering from anxiety because I'm thinking about, gosh, how am I going to pay my bills next month? How am I going to pay tuition for my child? Even with the whole political thing, what's the state of America? So people are not managing the mind, and food does play into that for sure.
When you look at the state of society right now, mental health versus physical health, how do you make mental health more of a priority? I mean, you threw out a couple suggestions, that self-recognition and
Yeah.
self-understanding, but I don't know the data. I'm sure most people may be like myself, and maybe they're aware that there's a mental health deficiency, or you're not doing something to develop it or foster it. How do you kind of get in tune with all of that?
Number one is gonna be God.
Okay.
Number one to me is gonna be God. I feel like we live in a generation of influencers. So everyone's on the surface level, everyone, we lack a presence nowadays because everyone's on their phone, like, oh, let me put my tripod up so you could see me shopping for my groceries. So in this day and time, it's a lack of presence and it's very performative. So people are so focused on what's on the surface that a lot of people have lost sight of the spirit. And it's really the spirit that helps you live. So my advice to anyone that might be struggling with mental health is to be present. Sometimes when I'm at certain places, I'll wiggle my toes just to make sure I'm like, okay, you feel that, right? Or I'm like, touch you, or I'm like, okay, I'm here.
Right.
We're spiritual beings having a human experience. So sometimes I have to remind myself like, oh my gosh, I'm here. And I hope that we learn how to be more here. And I hope that we learn how to be just present. We really have to be present. And I think managing the mind is really just having that connection with God, because God's going to be number one. And if we stay present, we'll always have that peace because we're connecting with God. But I think if we could get back more so to the spirit living instead of the surface living, I think that will help our mental health. And a lot of times, even in my personal experience, when I was going through my healing process, when I was going through things, I wanted to run from the healing because it hurt. As soon as it starts hurting, I'm like, oh, don't like that feeling. And it's a part of life. We have to go through the hurt. If it hurts, good. Keep going to it. Crawl to your healing. You're not always going to be able to walk. You're not always going to be able to run to your healing. Sometimes you have to crawl to it, but don't flee just because it starts hurting. We all deserve to be present. We all deserve to be happy. And God's going to be number one, and you got to go through it to get to it. So they say.
No pain, no gain.
No pain, no
Melissa,
gain.
did you have a thought?
I love everything about what you just said. And something I would want to add is that we have to slow down. Going back to my grandmother, when she was in her 70s, I used to watch her pray, and she would pray on her knees. She was able to move very well because she was working in the garden and she could do the things. And I thought, well, maybe if she's on her knees, I need to get on the floor. And so now I do pray on the floor. And if we use those times to listen, and sometimes we're afraid to listen because the hurt comes through and we hear, here's what you did wrong, here what you did wrong, here what you did wrong. But if we listen a little longer, I think we'll hear opportunities and ideas from God. I think He will send messages to us.
Absolutely.
So sometimes I think we just need to stop, slow down, breathe, wiggle your toes. I love that. Just kind of bring yourself back and just take 5 or 10 minutes and listen.
And I want to touch on that because a lot of times, I know you mentioned praying and there's so many things coming to our mind. I think a lot of times too, the enemy wants to, give us a title like, you used to do this, you were that, you were this. Remember this when you did this when you were 17? Oh, you're not going to become. But then we have to remember God's truth. So
Those labels can be dangerous.
yeah, and it affects our mental health.
You mentioned being present. Last week, and I was in Charlotte with my 5 and 8-year-old grandchildren, and they kept wanting to have me take them to GameStop.
Oh, yeah.
And
Sounds like someone I know.
I refused, and even their mother was like, well, it's not a big deal. I'm like, no, it is, because that removes them from being present. Hey, I'm only here 48 hours. I want full attention. I like that.
Yeah.
And it also that there's a generation out there that is lacking some interpersonal skills, which is gonna strengthen or diminish their mental health capacity
Mhm.
at some point in life. And we just wanna make sure people are present as much as possible.
Absolutely.
So I appreciate that present. Do we have a question from the audience?
Yes, of course. First of all, I want to say thank you so much. You're leading a great conversation. You ladies are absolutely marvelous today. Thanks for bringing this information to our community. And my question is, in your opinion, what are the biggest barriers that people are facing in accessing mental or physical health care, and especially in communities that we have declared our deserts?
Would either one like to
Okay.
initially?
I would say, I think when it comes to accessing healthcare, I think a lot of people don't want to admit that they need help. Especially in our community. I remember growing up, and I'm like, I would tell my parents, like, oh, I feel like this, I think I'm depressed. And it's like, don't say that. You don't say that. But it's a lot of people, I think, don't admit that there is an issue because we're so used to being strong. We're so used to burying the hurt. But now, professionally, I do work in the insurance field, and we get agents contract. We have about 17,000 agents nationwide that are contracted with various carriers. And all of the carriers, whether it is Humana, whether it's Molina, whether it is Oscar, they all provide mental health services. So these services are available. I think people don't want to access the care sometimes due to shame towards going to a therapist. But I love when I hear people are in therapy. That's attractive. When you're in therapy, I'm like, good for you. But it's definitely out there on healthcare. I think people just, there's a shame, there's a stigma towards it.
I think that's very true. And the other thing is, we see a dentist for our teeth. We see a podiatrist for our feet. So all of those things, we need to see someone, a therapist for our heads. I mean, and we should probably do that fairly regularly. Lots of younger folks. Now, the good news is I'm seeing that folks in their 20s don't mind. It's kind of like, I'm going to my therapist.
Yes.
What about you?
Yes.
And she talks, and I know a lot of folks who do that now. So keep those kinds of things in mind. Therapy is okay. And we should look to our 20-year-olds who are going to therapy, who have good insurance and don't mind because all of their friends are doing it as well. Kind of like, why aren't you shopping?
Yeah.
So, really good opportunity.
Absolutely.
The notion of access and getting to, think about on the physical fitness side, are there plenty of Silver Sneaker locations that are available to people? Or how do they get access to physical fitness?
Oh, that's a great question. I'm so glad you asked that. So with Silver Sneakers, there are 30,000 locations across the country where folks can go to work out. But one of the nice things about Silver Sneakers is that individuals can take classes. There are classes made just for seniors, designed just for folks who are 65 or above. They usually have a chair, there are weights, there are bands. And not saying that those classes are not challenging, because I think, maybe not you, but some of us, if we take those, we might break out a little sweat every now and then. So classes are so important for a number of reasons, because folks will get to be around others, so you form a community. You will, and sooner or later, when you're not talking with your class members, you sort of, you feel a little bit lost. And they also do add to your mental health, if I see you all on a regular basis and I don't see you, I call you up, hey, how have you been? What's going on in your world? So I do think being able to go to different locations every day, which you can with Silver Sneakers. You might go to a pool with your girlfriend on Monday, you might go do yoga. at a local LA Fitness on Tuesday. All kinds of opportunities to work out, and even when you travel, you can do the same thing or work out from our app. So all kinds of opportunities.
Okay. Let's talk participation. So obviously, as a mental health practitioner, people engage with you, do they become your client? Outside of, traditionally mental health was probably addressed by the minister of the church and or a family member. That's who you went to and confided in for those issues. Now there's coaches, life coaches like yourself out there. How do people participate with you and get engaged with you?
I think both having the platform of the podcast, I'm really big on sharing inspirational stories. And just because we do live in a world of influencers, so I think people engage and have a sense of community through the Heart Helper podcast because we have guests on that are being vulnerable. And I feel like when you're able to share your truth and be vulnerable, someone else will listen and be like, oh my gosh, I went through that too. Recently, I had someone that is a recovered alcoholic on our latest episode, and there was a lot of feedback like, oh my gosh, I'm struggling or I'm going through that. So I think people connect with the Heart Helper podcast because we have people that are relatable. And I do want to bring up that there are areas in the world that are called blue zones. Sardinia, Italy is one of them. And studies show that people that are connected to a community tend to live longer. And I think Okinawa, Japan is one of them, and you mentioned community as well. So if we could create more connections, I think we would see a longevity in our mental, our physical, our spiritual. So the Heart Helper podcast is that platform where we're connecting community and we're creating safe spaces. I am a certified life coach, and I feel like I became that because I was just helping everyone, and just naturally, that's why I created the Heart Helper. But I think through connection, like you stated, I think we'll see a difference in our world, and not only the 20-year-olds, but seniors, my son, my mom, if we just could connect with each other, and we do that through vulnerability and sharing our stories, sharing our truths, and not just posting what's pretty, we gotta post our pain as well.
I love that. So I'm thinking that the Mary Parker Foundation may be onto something for long life because our community we're in community conversation, this
Yes.
program right now. Melissa, tell us about participation on the physical fitness side. Then we'll take another question.
Participation. So our studies show that when folks are going to these silver sneakers classes, and by the way, silvers or memberships at gyms are paid for by the insurance companies. So if anyone who's participating in Silver Sneakers, Humana, Aetna, Anthem, those companies are paying for their insurance because studies show that folks who participate in Silver Sneakers are less likely to go to the doctor, they're less likely to spend time in the hospital. And we also get reports from folks who say that they couldn't take the stairs at their home, even 1 or 2 stairs, so they wouldn't want to leave the house because they couldn't get back inside the house. But just participating in Silver Sneakers for 3 months, 3 times a week, going to a class, getting on a treadmill as best they can, their life gets so much better. And I'm gonna jump back to the blue zones. I love the blue
Me
zone
too.
conversation. Blue zones, another part of the community is just what you said earlier, Kenny, spending time with family. Family time. When you do study those blue zones in Italy, folks are working, they continue to work as long as they can.
They never retire.
They don't retire. And they're working outdoors. They're working with family. They still eat with family. They spend time with family. So all of those things add up. And I think, to your points, good for you for not going to GameStop.
No,
Consistent, but you wouldn't go to GameStop. But yes, participation in anything like that, out in the community, getting your workout on, playing tennis, doing all the things. I see some folks out there in the audience who play tennis, and I do play, so love that community environment. But yes, participation, even if you can't do anything, just go and be around people.
Osmosis, it'll flow in, right?
It'll flow in.
Again, I'm
Question.
loving this, I'm absolutely loving this, and it's so important that we keep our community involved. And I'm thinking about community right now. We are fastly approaching the holidays. And I know that holidays bring on additional stress. How can we as family, community, identify some of the warning signs of someone who could possibly be declining, both physically and mentally, especially during seasons like this?
Sure.
What are some of the signs we can look for?
As we look for those signs, and I'm gonna pass to Jody on this first, but obviously making sure that you're present, going back to Jody's initial comment about being present with family. Be intentional about rattling those family members that may be not always on your radar. I've got relatives here in Atlanta that we don't see often. Be intentional about calling them, checking in, and making sure that they're doing well, because there's nothing more than to suffer in silence. So, to Dr. Parker's point, what are some early signs that we could detect?
I think some early signs that we could detect, which I think is a good question, are people that try to withdraw. I noticed some people that go through depression, you don't hear from them, or they're not answering their phone, you're constantly reaching out, or even, it could be weight gain or weight loss. And it's like, okay, I'm checking in, how are you doing? But a lot of times we could see physical signs on people. Also just, I think of, again, going back to being more present, if we took the time to actually look at each other in the eyes, check in, see how people are doing. But I've noticed in times past, it's usually weight loss, it's weight gain, it's people trying to hide. Because when you're depressed, you don't want to be around anyone because you don't want anyone to judge you, or a lot of times you don't want people to look at you or, look down on you, or you don't want to burden anyone. So I think it's kind of sometimes people hide in their depression. They might not answer. Even with holidays, some family members might not want to come around, but I think we just got to keep praying for people and keep pulling on them. But if you notice weight gain, weight loss, people are not really, reaching out or responding to you as much as they do, pull up on them. Be that person, pull up on them. Hey, knocking at your door, I'm just checking on you. Send them a card, send them an edible arrangement. And just let them know that you're there, keep being persistent, but I think that's the main thing is people retreat when they're sad or they're depressed or they're anxious.
Look, I see why you're a mental health coach. I get it, a life coach. I get it. Yes, yes, yes. Yeah. And the only thing I would add is when you're at these events, there are certain triggers, by the way, this doesn't totally answer the question, but will be certain triggers. They say if somebody starts talking about politics, maybe right now, I don't know if everybody in your family is on the same page with politics, but maybe if the politics comes up, there might be somebody who doesn't necessarily agree. So maybe that trigger is not the best trigger, best thing to talk about. Maybe I don't know, there could be optimism. So keep that in mind. But I do think if you see somebody sitting in the corner at Thanksgiving dinner and they're not really an aunt so-and-so that you don't talk to very much, go spend some time. Because as I get younger, I do appreciate phone calls and younger folks checking in on me, because it kind of, adds once again to that happiness factor. It's like, oh, so keep those kinds of things in mind. If you see somebody sitting in the corner, like you said, pull up, pull up beside them after dinner while they're eating dessert. Ask them what's going on, how have they been, what are they doing during the day? Let them know that you care. Tell them that you're going to come and see them, and then do it.
I like that. I like that. I want to go back to nutrition. We see that as a key, both physical health and mental health. I'm just going to cite another statistic for us. School nutrition and physical education facts here in Georgia once again. School lunch program in the United States. The state of Georgia has the 5th largest school lunch program, which correlates to low-income students needing a meal. School nutrition expenditures, almost $1 billion. 80% of this total cost is for food and labor to provide it. The average number of school lunches served daily is over 1.1 million. Students eligible to receive free or reduced price meals in 2013, over 1 million. So obviously, actuaries and others look at this data and create and formulate policy. From our seats as mental health and physical health practitioners, when you hear those data points, what are you thinking as far as your next move around how you engage with mental health client or physical health client, knowing that there's probably some nutrition answers that they need in their lives?
Yeah, sure.
I think first of all, we have to model it. My husband has had, Alzheimer's on his side of the family, so he immediately changed his diet, and now he's pescatarian, going towards vegetarian. And now it is rubbed off on me, so he, fixes himself a bowl of fruit every morning, fixes me a bowl of fruit every morning. And now my 24-year-old daughter's kind of getting it slowly but surely. And so, because she's living at home right now. So I think first of all, we have to model those things as best we can. And we have to, read labels. There are now all kinds of apps that can read a label and tell us whether or not this is a good item or a bad item. By the way, you can buy those, those labels apply to the lotions that we apply with all the stuff we can't mention, all the cosmetics that we buy with all that stuff, that we can't, the words that we can't read. So read the labels, and I think we should model, and I think we should demand from our local grocery stores that they need to have those items. And I also think we need to frequent farmers markets and learn as much as we can, from our farmers markets, from the farmers, what's in this, what's this good for, have your Google out. It was kind of interesting. I met a gentleman who had been on the show Chips many years ago, and he told me he had been fighting cancer, and he said, well, what my doctor told me to do is he said, I'm cancer, he's still working with cancer, he's now in his 70s, but has had it for many, many years, living with it, doing his thing, strong man. He says he does protein and soursop. What's soursop? Yeah. Yes.
Anti-cancer
Yes.
agent.
Anti-cancer and aging, soursop. Y'all look it up.
Yes.
I have now, so yes, and he was like, so, and these are things, a lot of these kinds of things, doctors are not paid for, right? Doctors are paid when they prescribe medicines for you, they get paid by the drugs companies. So they're not gonna always tell you all the foods that we should eat. Or the fruits that we need to take in, but y'all check out soursop. I do soursop sea moss drip every morning. So just, just a little thing from my tongue that I got off of Amazon. So just keep those kinds of things in mind. There's all kinds of fruits and vegetables that we need to be eating, and we need to model the right way.
Before you pass, Melissa, you talked about modeling, what your husband was doing with the fruit. And that's a great modeling, and obviously it's transcending to the next generation.
Yes.
I'm just curious, you had mentioned earlier that there was some nutrition programming that you do on the day job as well with Silver Sneakers?
With Silver Sneakers, yes, Silver Sneakers does have some online classes. We have some YouTube classes. That anybody can access. Just go to Silver Sneakers Nutrition. There's an 8-minute overview on fruits and vegetables that we should be eating, what's good for what. And then also we have a number of online classes that one can take. Just, at your leisure, just to play it and watch it and learn and shop properly. So with all kinds of ideas. So yes, nutrition is, we need to let the preservatives go. We need to let the fried foods go. There's all kinds of oils. I mean, you can really get in the weeds onto what's good and what's not good. Something I'm wrestling with now is how much water do you need? I don't know if you can answer that question. I've read that, you're supposed to have half of your body weight in water. I just saw something. I do follow some Instagram social media pages where they're talking about health or say, maybe you shouldn't have that much water. I don't know, I think you should have a lot of water, but there's always the back and forth. So I think we have to watch what we do and, try to make the best decisions that we can for ourselves.
Like that, like that.
I do want to bring up, because I do have a school age child, my son's 10 years old, and you mentioned school lunches. My son will not eat those school lunches. He will rather starve. He's like, Mom, you should have seen what it was today, but I know that is the only option for some families. But if you can, I would suggest packing a lunch, because you know what's in it, and I know we struggle with a lot of preservatives in food. And your nutrition, I think, is not just what you eat, but it's also what you're listening to, and it's also the things that you are watching. So not only be mindful of your diet, what you're consuming, but also be mindful of the music you're listening to. Be mindful of the movies that you're watching, because again, that you're consuming it and that is a part of your diet. You guys mentioned sour sap. Both my parents are from Jamaica, and we grew up drinking, boiling the leaves. And my father recently experienced prostate cancer. So before he went to go start radiation, his cancer levels were significantly high. He started drinking sour sap tea and moringa. Also, sea moss. I think our body has 102 minerals. Sea moss has 92 of those minerals. When my dad went back to the doctor, his cancer levels had shrunk significantly. And that's just using natural medicine from Jamaica. So I do feel like there are ways you could heal your body naturally if you change your diet.
Cool, love that. Question,
While we're there,
sure.
I recently re-engaged holistic healing. I was one of those individuals who suffered with everything that could be wrong with the gut. Once I got on this program, and I just asked her to call to see if we could get her to come live on Zoom to discuss some of the products and herbs that she's using for healing. But it's been absolutely amazing. And one of the other things that we should be conscious of, especially with our mental health, is the all the toxics that we're taking in from the medications, from the air, the water, everything we're doing, our body is containing that, and we're not releasing it in any way. She has a wonderful, wonderful herb that I've done recently. Absolutely amazing. It's drawing the mucus out of my body. It's drawing all the toxins out of my body. And when I leave there, I feel like I'm floating, but I look like I'm glowing.
Wow.
So I
Sign
hope
me
that
up.
she
Yeah.
can come on.
Yeah.
I hope she can come on. Because even with the sea moss that she's doing, the soaps, everything is just, it's all natural.
Yeah.
And I do remember my grandmother was a gardener as well. And she used to tell us that everything we need for healing is right over in that cupboard. It's in the kitchen cabinets. So yes, this is great, and I'm very happy to hear that you're tying holistic healing approaches with that. What we're so accustomed to are the drugs. So thank you for that.
Hopefully she'll be joining us to impart some more information.
Yes, she'll let us know if she's able to come.
Wonderful. We talked about behaviors and what we do on a day-to-day. So just want to cite a little more data here around fruit consumption. Only 18% of high school students ate fruits or drank 100% fruit juices 3 or more times per day during the past 7 days of when this survey took place, which is interesting. Vegetable consumption. Only 11.4% of high school students ate vegetables 3 more times per day during that same 7-day period. Breakfast consumption. We all grew up, breakfast, the most important meal of the day. Can't start your day without it. I can honestly admit I don't practice that as much as I love breakfast foods. I don't have an appetite. And I know I'm doing harm to my body by not eating until 1 o'clock, 2 o'clock, using my first meal of the day, a late lunch. So I would definitely fall into this one. Breakfast consumption. 16% of high school students did not eat breakfast during that 7-day survey period. Which means that 16% of high school students went to school hungry. And were probably not as alert or engaged as they would otherwise be if they had eaten something. Sugar sweetened beverage consumption. 24.4% of high school students drank a can, bottle, or glass of soda one or more times per day during that 7-day period. So we talk food, we talk nutrition, now we're talking about behaviors. And if it's starting at the high school level, I think we all would agree that it's gonna just foster and develop as they mature into college students. So now they're no longer under the rooftop of their parents' guidance. Now they're making their own decisions. So maybe 1 soda a day is now up to 3 sodas a day because there's no mom, there's no dad, there's no older brother, sister there to say, it's not your second can, it's not your 3rd can. So when you look at these behaviors starting at that level, what is that we should be concerned about as they mature into a young adulthood?
I think Melissa mentioned it, modeling the behavior, and I think we have to be concerned because if you're not eating right, you're not getting the proper nutrition, so they're not able to function fully at 100% of their potential.
God just saying, y'all are doing a great job.
Yes, listen, the spirit is here. But if you don't eat well, you can't live well. And I've noticed just in even my son, I'm like, okay, we'll go out and he's like, well, can I have a soda today? And I'm like, because I usually don't give him a soda, but we have to model behavior. Instead of soda, I'll do sparkling water at home. And he'll drink the whole thing of the sparkling, like he loves sparkling water, but like you said, we have to model the behavior that we want these children to become, because we can't expect them to grow up to be these great adults and we haven't modeled that behavior with how we eat, how we talk, how we carry ourselves. But I do notice they try to give children and label them like as having ADHD. And a lot of times I'm like, is it ADHD or is it the foods that they're consuming? And are they consuming those foods because that's all the family can afford? Looking at the rising rent prices, the cost of living is significantly high. Even when I'd buy fruits for $4 3 years ago, that same bag of fruit is $8. So I think a lot of times people are buying what they could afford, but like you mentioned earlier, going to the farmer's market could be a plus for us because it's affordable, it's fresh, a lot of it's organic, and we're also supporting the local community. But model the behaviors that you want your child to see. You know, as we grow and as we become, none of us are born parents. We're constantly learning, and we give our kids this foundation, but we want to make sure that foundation's sturdy. So model the behavior that you want them to see, and there are healthier options. Instead of soda, try sparkling water. They have a lot of great flavors, and be what you want to become. So
Not a whole lot to add. I think you guys have hit on it. I think it's a struggle for students in school. For adults, it might be okay for us to do some intermittent fasting. I'm reading a book for folks who are in menopause, us ladies, and sometimes it's best for us to eat a little bit later. When we go all the way back to prehistoric days, and when the human could not eat every day because there were no refrigerators, so they would catch something, eat for 2 or 3 days, and then have to wait a while. So it's kind of okay for us as adults to be able to do intermittent fasting. Now, kids in school, that's different because they're using energy. They've got the minute they get out of the car or off that bus, life begins hard, and it's, all kinds of challenges out there. So I do think that they need to eat. And, and Michelle Obama tried hard to get those lunches right. She tried, people fought it, unfortunately. So I don't know where that went after that, but I think there's a lot of work to be done. And to your point, you need to, maybe we can buy in bulk. If we can go to Sam's and buy celery or carrots and, put those in the lunches, and we take those and put those in our lunches as well, or, you know, if you work from home, just have that stuff ready for ourselves. You know, some folks have the fruit cut up for the week. They do that meal prep
Yes,
on
yes,
Sundays and cut
yes.
up the pineapples and cut up the carrots and, you know, apple slices and things like that. Maybe that would help for the kid who's running out of the house and just needs something to eat on the way into school and can just pop in and eat those things during the day.
As we wind down, let's talk remedies, solutions, next steps as it relates to mental health, physical health. On the mental health side, there is a Department of Behavioral Health and Developmental Disabilities. And here in the state of Georgia, they operate hospitals and they provide for community-based services across the state through contracted providers. That is obviously one good starting place for folks. All of their information is online, they can get access. The department serves people living with mental health challenges, substance abuse, substance use disorders, you touched on that earlier, Jody, intellectual and developmental disabilities, or any combination of these. As Georgia's public safety net, their primary responsibility is to serve people who are uninsured. They also serve individuals on Medicaid and others with few resource options. So I think for a large audience, that's a great starting place. I think another, when we talk about solutions, remedies, next steps, your podcast, and I want you to speak a little bit about how they can engage with your podcast, because just like this community conversation from the Mary Parker Foundation is critical for community learning and gaining knowledge and understanding what is happening out here in these streets. Your podcast is a channel as well for a topic that may be a little uneasy for me to just raise my hand and say, I need help or I need information or guidance. But if I could tune in to Jody's podcast, get some intel, and then make my own moves, I think that might benefit a whole bunch of people.
Yes, absolutely. So the Heart Helper podcast is available on the second and fourth Sunday of every month at 12 p.m. Eastern Standard Time. We are available on every streaming platform, YouTube, Spotify, Apple Podcasts, and it is a safe space, like I mentioned earlier. If you're not in therapy or you don't feel comfortable going to therapy, we do have a few episodes where there is a therapist on there, and you could reach out to her privately, or you could reach out to me privately as well at info@thehearthelper.com. If you have questions, if you have concerns, if you do need some therapy, I could direct you in the right path. If you're struggling with food insecurity, I could direct you to the right co-op ministry or the right faith-based organization that could help you. I also wanted to mention, because I know a lot of people are losing Medicaid right now due to the great unwinding. When COVID came about, a lot of people were eligible for Medicaid that are no longer going to be eligible for Medicaid. So please make sure that you're checking your mail, make sure that you're responding to those notices. And if you're no longer eligible for Medicaid, please know that you have another option on the Affordable Care Act, or as we call Obamacare. So even if you're losing Medicaid, you still have other health insurance options available to you with very low cost. But again, you can email me at info@thehearthelper.com. Please, I could connect you with a therapist, food insecurity, whatever I could do to help you. This is a safe space and we are a community, no judgment, and all love and all light.
Love that. So I could walk around the block, I could go to my local school track. But if I want to get engaged more formally and more intentionally, Melissa, tell us how I could next step get engaged with Silver Sneakers as an option.
Sure. So Silver Sneakers is a program for folks who have Medicare Advantage. So first of all, there's traditional Medicare that anyone can get who's worked in the United States for 10 years. But Medicare Advantage is a little bit different. It's a sort of a buy up, sort of. And so it includes Silver Sneakers. So we recommend that seniors, as they're making those Medicare decisions, that they talk to a private company, someone from a private company like Humana or Aetna or Anthem or Devoted, and ask for Silver Sneakers by name. Then they have access to all the gyms, pools, yoga, all kinds of classes, walking tracks, classes all kinds of really great in community, the sense of community. So just ask for Silver Sneakers by name and make sure that their plan has Silver Sneakers.
Excellent. Amber, are there any questions from the audience?
Yes, sir. We have a question from Dorian. They asked, how can we better support individuals in overcoming the stigma associated with taking FMLA for mental health? And what resources or strategies can therapists use to guide their clients through this process effectively?
You said the stigma for FMLA?
Yes.
Well, I personally have taken FMLA, myself before. This was years ago. And I just felt like I just could not work, like mentally, physically, I just could not. And I was able to go to my primary care doctor. I kind of discussed with her what was happening. I explained to her the symptoms I was having. She let me know that I was depressed. And sometimes you do have to step away. So please reach out to your HR coordinator, your HR director, and let them know that you need to take FMLA. And also keep in mind that a lot of times FMLA is not paid. It just provides you with job security. So you want to make sure that your finances and your bills are still going to be able to be paid during this time. But take FMLA. I've taken it before when I was, maybe I'm 37 now. Where does time go? But maybe about 10 years ago. But I'm so thankful that I took that time, because if I wouldn't have, I don't know where I'd be today. And it's not that I took it and did something extravagant. I just had to step away and have some me time. So please reach out to your HR coordinator, but also keep in mind that it isn't paid, but there's no stigma, no judgment. If you're making yourself better, don't let anyone shame you for doing that. So.
Great point. Okay, any other questions from our studio audience?
I guess I may have a question. At what point do you, and this question is, at what point, so for someone who's struggling with, honing in or, taking my mental health seriously or prioritizing it, so to speak, how soon or at what point, do you feel like it's appropriate, being that we're so disconnected from seeking the mental health assistance? Like, what are preventative measures without reaching the bottom to seek help, I guess?
I would say, you don't have to hit rock bottom before you go to therapy, right? And even if you don't feel comfortable, take a friend with you, but don't wait till it gets so bad to where you just feel like you want to end it all. About a year ago, I had a cousin commit suicide, and he knew mentally, he's like, oh, I need a little help, I need help, I need help. He was taken to the hospital. And he told his dad, he's like, well, I'm just gonna go, have a cigarette. I'll be right back. Cause he knew, hey, dad, I need help. You need to take me to the hospital. I need to get my medication. His dad noticed that he was gone for a significant amount of time. When his dad went out to find him, he had jumped from a bridge. So I say that to say, of course, it's sad. It's very hurtful. My family struggled a lot, but don't wait until it gets so bad because you want to run away from therapy or you don't want to take that step even if it hurts, because you don't want your family to cry over you. You don't want your family to cry over you, and I'll go with you if you want me to. I'm a lot of fun.
And sometimes that first step is just speaking it out into the air, into
Amen.
existence, and I commend you for that. Just to share it, and someone's listening, whether we believe it or not, someone out there is listening. So with that, yes, sir, we do have a question.
Well, I do have a question. So, about 2 weeks ago, I lost a coach of mine. They're saying that it's possible suicide, but the method that he used to, end his life was just unhealthy eating habits. And I think he drank about 3 liters of RC Cola. And he wasn't eating properly, so he just hinged on unhealthy. So my question to you is that when everything seems perfectly fine over a phone call, what are some of the strategies as far as doing a wellness check with your loved ones or friends who you know live in high stressful jobs or live in stressful environments? What are some strategies in terms of how do you just say, are you good? You know, because when we are, how you feeling? I'm good.
Right,
Mhm.
right.
And the world could be
Caving in.
caving in.
Yeah.
What are some strategies as far as getting to the real root of the problem if there's one that exists?
Sure, and that's a great question. I think initially, putting eyes on someone is the best way to do that. And oftentimes, as Jody spoke of earlier, people will try to be avoiding contact or engagement. But knowing them as family member or as a friend, you know their favorite things. And maybe that's a reason for you to drop by, maybe unannounced. Offend them that you drop by unannounced, but guess what? I got eyes on you and I can tell you've been ducking me. And that's why I'm on your doorstep. So receive that or not, I don't care. And I just think sometimes we have to be bold in our approach to caring for those that we say we care about, as opposed to just letting them tell us whatever they're telling us, accepting that and moving on, because life is life and for all of us. So we just have to be intentional.
I just want to say, I think one thing I started doing, I had some, typically when we meet each other, greet each other, you're like, oh, how you doing? How you doing? And we always say, okay. So I had someone ask me one time, he's like, no, how is your heart? And when he said that, I couldn't even lie. I'm like, well, I am kind of depressed. So let me tell you, but when someone said that, it's like changing the wording. It's like, how is your heart? It's like my heart is hurting instead of just because how you're doing is kind of generic, but no, how is your heart? And I think sometimes it's not always even sometimes asking the question. Sometimes you just got to show up and sit with the person. They might not want to talk. They might not, just want to talk about the situation. They just want to be in the presence of someone. So sometimes it's not even asking. Just pull up on them, sit down, watch their favorite show with them. Because you never know what they're going through, but they know someone's there, and when they're ready, I feel like they will say something.
I am no expert at this, but what if they live in a different city? I wonder if you could tell them, hey, we're gonna do a FaceTime call on Thursday. I'm calling you by FaceTime. Pick up, because this is my check-in. I'm checking in with all my friends. I wonder if we need to do something like that. And one of you all mentioned earlier, I think it's kind of cool for us to sit and write handwritten notes to people. I've done that before. And then, write the note to him or just send them a card or something and then follow up and say, hey, how you doing? I'm coming to see you. I'm doing or maybe send them the note that says, I'm gonna do a FaceTime call with you. And they will probably pick up or they'll probably answer in that way. So just thoughts. I love what you were all saying. Maybe that's one more thing to try if they live out of your vicinity.
A couple of things. One, the young lady, Ajay, is on the line now. If we could maybe chime her in to go live. She's unmuted. She's unmuted. Okay, Kenny, would you invite her in, please?
Yes, how are you,
She's
Ajay?
got the holistic approach.
As you come off of mute, we're happy to have you on this month's community conversation. We understand that you got some perspectives on holistic approaches to herbs and better mental health.
Can y'all hear me?
Yes, we can.
Greetings, family. How's everyone?
Well,
Good, good. I came in on the end of a sister saying a very sentimental thing of checking in on your heart. And these days and times right now in the holistic wellness world, due to the channel of events, the current events that have taken place that have somewhat affected all of us, energy is very low right now in our community. So checking in on each other is very, very important at this time. So check in on your family, check in on your friends, check in on people who you love. Because a lot of times what we find in my industry of holistic wellness is that everybody is looking good, but that doesn't mean everybody is good far as their mental health, far as their emotional health, and definitely far as their spiritual health. And so my approach as a inner health and wellness lifestyle coach, I've owned a holistic wellness studio in the city of Atlanta, Metropolitan for 10 years. We just recently moved in September, but I've coached a lot of women, definitely starting off with the divine feminine, into how to be well holistically, not just appearing well or acting well or speaking well, but definitely being well in your heart and your soul. And I think Spirit brought me in on the right ending of the sister speaking, because I always speak about what condition is your soul in at this particular time. And it's very important that we, as a self-love and a self-care measure, always check in with our souls to see how well we are really doing. Because a lot of times, if we speaking in truth, we're not as well as we think we are or we pretend to be. And that is how sickness and disease and illness is able to come in and attack in our communities, because we're acting the part, but we're really not the part of being well, mind, body, and soul. And so I definitely wanted to chime in on that. Of course, we use holistic herbs, we use tinctures, we use bitters. I do vaginal hydrotherapy for women, which is a ancient healing practice. That's what the Sweet Spot has been doing for over 10 years. We've been on Married to Medicine. We've been on Little Women of Atlanta. We've been on Growing Up Hip Hop. We've been around taking care of our community for a long time, but it's very, very passionate for me to make sure our spirits are well. And that's what we use the approach of holistic wellness for. Because from an energetic perspective, a lot of times our energy is low. And when your energy is not vibrating high through your body, through your nervous system, your lymphatic system, your endocrine system, your reproductive system, your cellular and molecular system, and definitely our digestive systems, then anything else that we're doing is really not effective. And us, the diet that we have as a community is also affecting our health and wellness. So we make sure we guide people into living better in every aspect of their lives. And so that is very important in our community today. And so that's what we represent at the Sweet Spot Atlanta. You can go to www.sweetspotatlanta.com. We're so happy now that we are definitely putting attention on divine masculine to bring men into wellness, to make sure our men are healthy and well, mind, body, and soul. And so we do a service called the A-Steam for men, which they're able to come in and get their herbal detox as well, make sure their blood pressure, their prostate, their health, their sugar levels and everything is in alignment, because we know that men are very hesitant when it comes to going to the doctors. We do a lot of reactionary things. When things get out of control, we panic and then we may go to the doctors. But we as a community, and what Sweet Spot's approach is preventive maintenance, where I don't never have to get to the doctor's office. I never have to put the power of my health and wellness in someone else's hands. God has given me the right to make sure that I take care and love myself first. First preservation is first law. And so we have to make sure our men are well as our women. And we're also inviting our youth into holistic wellness so we can get them to begin to practice holistic wellness early in life, so disease does not have to be part of their existence. So I just want to thank Dr. Mary Parker for inviting me into the conversation. I'm always passionate to talk about the wellness of our community, because it's something that we haven't really focused on, because we've all been out living our lives, getting our degrees, starting our careers, starting our families, starting our businesses, but we can never leave out the health and wellness of ourselves, because that's what God gave us, to be vibrant and beautiful spiritual beings. So I just want to end on that note.
Ashe, thank you for that. Are you able to take a quick question before you depart?
Absolutely.
Awesome.
Just before the question, we did have a conversation where we were talking about soursop. Can you please address that? Because when I left, I felt very empowered to go home and begin taking that myself.
Absolutely, Dr. Parker. Soursop is a medicinal, it's a fruit that's not grown here in the States. It usually has to be in a tropical environment. And when I went to Jamaica and I was at a retreat, and we drank soursop tea every day, because they had soursop fruit growing on the land. But it was not allowed to be brought into the country. So when we went through customs, God allowed me, it's been years ago, no pun intended now, but I was able to get some soursop through in my suitcase. Soursop kills cancer cells. So it is something that we need in our community, because it regulates a lot of different things in our melanated bodies. That is why I feel like it's not really quote unquote legal over here to be imported. You don't see a lot of the farmers market carrying soursop. One of my clients did bring to my attention that Lake City, out in the south, on the south side of Jonesboro, that particular Lake City farmers market has had soursop. I've bought soursop, fresh fruit soursop, at that market, but they don't have it a lot. But if you would like, you could get soursop leaves and you can steep it down into a tea or a tincture or a bitter, and you could take it that way. Now, is it as potent as the actual fruit? Of course not. But at this point, we have to start somewhere. So we sell sea moss. I have a nurse practitioner that's one of my clients here in Atlanta at Northside Hospital. She's from Jamaica. She actually imports. Her family has access to soursop, and she makes our sea moss with bladderwrack, burdock root, and soursop. And I was able to bring Dr. Mary Parker a jar of that, because everywhere I go, I'm spreading wellness. It's just what God has given me as an assignment. So if you have access to soursop, it's something that we should all have in our wellness regimen, in our kitchen, in our arsenal, to make sure our families are well. I have children on it. That is, I went and did a house call last night with a client of mine. Her son is 1 year old, and he's having a lot of health complications. And we now have him, I have her making him like a soursop lemonade, and he's doing well. So we can prevent him from having to get surgery. And it's working. I've had a client on the soursop sea moss that had a mass pushing on her kidneys. I've just recently put the video up. She's about 70 years old. She had a stent in her abdomen for the kidney, and she had a tube put in her back. She's been working with Emory Cancer Center for a year. They've had 5 surgeries on her to no avail. They cannot find out what the mass actually is. She's been steaming that sweet spot for 4 months, and they just removed the stent and the tube last week. So we are so excited. And the steam, the hydrotherapy, and the medicinal benefits of the steam have shrunk that mass where Western medicine was not able to give her any kind of treatment. So,
Amen to that.
And to that end, I have a niece who's had breast cancer metastasized.
Yeah.
And she currently has it on her brain, her bones, her kidney, her liver, and everything. She's coming here on the 9th. I'm bringing her and we're taking her through some of the treatments and get her on a holistic plan as well.
Yes.
We do have a question. Judy, come on up, please.
Good afternoon, everyone. My name
Good
is
afternoon.
Judy Gaucher. I am a public health educator. But I just wanted to share, on a light note, that it was profound when I found out here recently that sitting is the new smoking.
Yeah.
Sitting is the new smoking. I was in a career teaching where I stood all the time. And I'm like, those teachers just sit behind the desk, what they know, I don't know. But I'm here to tell you, it paid off. Okay, and having to walk the longest distance, taking the students back and forth, run up and down these stairs. I'll be 70 in about a year or so.
Wow.
And in my house,
You look great.
I'm constantly running up and down the stairs. I don't have to hold a rail.
Yeah.
Okay, and some of it's genetic. I'm not going to pretend. Some of it is genetic, but I had friends younger than me. Judy, I'm watching you run up and down the stairs. You're not, and then someone else said it and it hit me. That's what it was. I stood my almost my entire career and had to walk the children here, bring them back, just constantly back and forth, back and forth. And I say what was meant for evil ended up being for my good. However that cliche goes.
Yeah.
But I tried not to park close to the door if I go to the store, walk.
That's it.
People have offered me, ma'am, you wanna sit down? No, I'll stay.
Yes, yes.
So that, it was just profound for me, and I just wanted to share that. Thank you.
That's
Thank
wonderful.
you.
Thank you so much for sharing, Judy.
Yes, yes. Can I just add one thing to what Judy just said?
Judy, thank you so much. That makes so much sense. And when I do get in front of seniors, I do tell them, don't just sit and watch a movie, and sit there. We've gotta always be moving, move your shoulders, pick up a can, pick up a bottle of water, do something while you're watching a television show. Park far away. Also, your car won't get as messed up because nobody's gonna hit your car, less chance for anybody to scar up your car. So yes, all those things are very important. And I've had folks say who are in their 70s, you have to keep moving, and because even if you hurt, you have to still go to that class, you still gotta walk, you still gotta lift some weights, lift weights, Judy, if you haven't started doing that yet. Lift weights, all those things are so important for all of us.
Outstanding. Okay, a few highlights as we close out this month's session. Remember, for all of this information, you can contact maryparkerfoundation.org. A copy of today's broadcast will be there as well. You'll be able to follow up with both Jody and Melissa respectively. Couple highlights for November. This Friday evening, our Black Lit Tree Lighting will take place. And do we have a time for that, Dr. Parker?
5 to 7.
5 p.m. this Friday, Junction 2800 Campbellton Road Southwest. Come visit with us, and that is a family event.
Yes, family fun music.
And let's light that tree. That's right. Every Monday, here at Junction 2800, we have the Black Men and Black Women Lab. And that's 6:30 p.m. to 8:30 p.m. Once again, this is another program empowering the community. And that's at the core mission of Mary Parker's Foundation, to empower the community. So every Monday we do that, 6:30 and 8 to 8:30. Starting in December, we've got on the 15th, which is a Sunday, we've got a Christmas toy giveaway. Go to the website for additional details. On the 19th, which is a Thursday of December, FACTS graduation. And the FACTS program is another pillar program of the community. And it's a collective of women entrepreneurs. And I get tidbits about that program, but if you could imagine Michael Jordan bringing together aspiring high school NBA players in a session once a month at no cost. That's what Dr. Parker does to these women entrepreneurs. She's giving of herself and imparting her knowledge, wisdom, and career success stories and failures to these women so that they can avoid these and become all that they can be. So that's a wonderful program. That's graduation, December 19th, 12 p.m. And then on the 21st, a Saturday, is the Christmas party. We've got a robust calendar already beginning for Q1 of 2025. Wellness Wednesdays will kick in 12 p.m. to 4 p.m. And we've got a Transform 2000 Youth Entrepreneurial program that's going to kick in the first quarter as well. And we're going to touch the lives of over 2,000 young people here in the Atlanta metropolitan area in a major way in 2025. So we need your support. We need your participation. We could use any resources that you all have access to or can guide us to. And that's maryparkerfoundation.org. With that, we're gonna bid you a good day and have a happy Thanksgiving. Thank you for joining us.